by automatically extolling our citizens into the National Health Insurance Program and expanding PhilHealth coverage to include free medical consultations and laboratory tests. The Universal Health Care Law that I signed today will guarantee equitable access to quality and affordable healthcare services for all Filipinos.
In February 2019, President Rodrigo Duterte signed the Universal Health Care Bill into law. The UHC aims to ensure that every Filipino is well, safe from health hazards and threats, and has access to reliable, high-quality, and easily accessible health care that is tailored to their specific needs.
Ideally, all Filipinos must be assured equal access to high-quality, accessible healthcare products and services, as well as protection from financial risk under the UCH.
Overburdened and understaffed, the healthcare system is on the brink of collapse.
Hospitals have been overwhelmed with patients, and overworked medical workers are urging the government to do more.
Aside from the shortage of personal protection equipment, our frontline workers are underpaid and undervalued. They also experience pressure, stress, insomnia, denial, frustration, fear, and most of all, being constantly exposed to the virus.
And then even us pediatricians, we're required to even assess adults when they come in.
Most of these patients are connected to a ventilator, connected to a cardiac monitor, which we don't have anymore.
Looking back, in 2016, the Department of Health Secretary Pauline Rosel Obial told CNN Philippines that they only produce only 2,600 doctors a year, and there's a lack of volunteers willing to go to rural areas. It is truly unfortunate that in the Philippines, for every 33,000 patients, there is only one doctor.
Moreover, there is a regional discrepancy throughout the Philippines. The national bed-to-population ratio is 1:1,121, with the level as low as 1:591 in Manila and as high as 1:4,200 in Mindanao.
Our health workers are burned out with seemingly endless number of patients trooping to our hospitals for emergency care and admission.
Hundreds of healthcare workers have had to be isolated, and several frontline doctors have died of the disease.
Under the Nursing Act of 2002, a salary grade level 15, or about 33,575 pesos a month, should be the minimum base pay of nurses in the country. But this is not the case. A junior nurse receives only a salary grade level 11, or only around 21,000 pesos. For around 2 decades now, nurses have been fighting for their rights to increase their salary pay, but until now, they are still to be heard.
Officials of the Philippine Health Insurance Corporation, or PhilHealth, have allegedly pocketed around 15 billion pesos from the agency.
Last August 2020, an ex-PhilHealth anti-fraud officer claimed that 15 billion pesos of PhilHealth funds has been stolen by the current PhilHealth executives, which has been labeled as the crime of the year. PhilHealth is an insurance company owned by the government to help the Filipino people in covering their healthcare finances.
Unfortunately, all of these issues are still rampant in our nation today. May we all acknowledge that health care is a human right. Let us stand that healthcare is for everyone and not only for some.
To the Department of Health, may you prioritize the quality healthcare for all the Filipinos, especially in our current situation since we are in a pandemic. Be alarmed that the healthcare system is at risk. We are in their need of proper responses to provide proper facilities and healthcare services, not only for us, but for the healthcare workers as well. We should take in consideration the health of everyone, for we are talking about crucial situation which is the lives of every Filipino. Take action now. Take action before you are the one at risk. You have the power and the resources. Please listen to your people and respond to their medical needs. Please act now before it's too late. We trust you. We believe that you can. Be DOH. Be defenders of health.